Hi, and welcome to And So Much More. I am here with Robert Booz. Thank you so much for joining us.
You're welcome.
You are our Chief Revenue Officer, which I am sure comes with a wealth of responsibilities. Right now, living in the world of the biggest change that we're seeing in a while related to Medicare Advantage and Humana specifically. And so Medicare can be tricky to navigate on its own, aside from big drastic changes that impact your healthcare. And so what we want to talk about today is the most recent change that was announced that effective in 2026, January 1, Centra has chosen to not move forward with Humana Medicare Advantage. And so we just want to talk about what that means for those of you who are Medicare Advantage members. And also like the finite things that you need to consider. Like, what do I do if I have an appointment after January and I have this coverage? How does that impact me? How do I get the right care in place? There's a lot to consider. And so we're going to make this just as clean cut as we can for you. And so first of all, thank you. Thank you for coming on.
My pleasure.
Tell us a little bit about you and your role here at Centra.
Well, you mentioned the fancy sounding title, Chief Revenue Officer. It's kind of a fancy way to say I'm responsible for the patient accounting, the patient finance side of the Centra world, which is quite large.
I imagine.
It's quite a lot of responsibility. I'm thankful to have such a wonderful group of caregivers that work on that side of it for us. That every day try to keep the patient as the focus, to assist in getting the maximum reimbursement we can from health insurances and payers, so the patient's burden financially is as less as possible.
Yes.
So it's a lot of words to say, that's what we're responsible for, but it's a pretty serious responsibility.
It is. So we want to dig in here and, just to be as clear cut as possible, we have chosen to not continue this relationship with Humana effective January 1. So right off the bat, does this affect all Humana plans or only this Medicare Advantage subset in addition to those who have, standard Medicare?
I mean, to go from the top, Cammie, it has been this is not something that we came about and discussion that we decided quickly.
Yeah.
This has been planning for quite a while. We wanted to make sure that we kept the needs of our patient forefront at all times, that when we're thinking about, leaving the Humana Medicare Advantage network, that we see that from the patient's perspective, that we had a very diverse team of areas within Centra, from community relations to folks that work with the, underserved areas of our community, to get their opinion. What should we do? How should we message this? How should we reach our patients? Because it's a big decision. It's a very big decision, and we understand that, and that's why we set up the way that we've discussed it, the way we're talking about it, with that firmly in mind.
Yeah.
So this is primarily for Humana Medicare Advantage, for those patients that have opted to not have traditional fee-for-service Medicare. You're going to hear that term, fee-for-service Medicare. That's your regular, what we call red, white, and blue Medicare. You get the red, white, and blue card. You worked your entire life to retire, to be eligible for Medicare. You're now eligible for Medicare, or you've become disabled and eligible for Medicare. You've given that coverage up to go to a Medicare Advantage plan. So that's the portion that we're talking about. We are planning to leave the Medicare Advantage side.
Okay.
This does not impact it, and I've seen a lot of questions about this. Humana administers the military plan.
Okay.
So there's a lot of confusion initially. Oh no, there's going to be, Centra's not going to take the military plan, Champ VA, Champ Us. That is not true. We are going to continue to deal with Humana on the TRICARE, that portion. That does not impact that. This is the Medicare Advantage side of it.
Okay. That is really key information. There's so like language that is so similar that I think really confuses and muddies the waters here. And so when it comes to, maybe it's important to talk about really quickly, and this is not on here, so I apologize, but What is the difference between a Medicare plan and a Medicare Advantage plan?
That's a great question, Cami, is that the traditional Medicare, so go back to that word traditional Medicare, also called fee-for-service Medicare, also called red, white, and blue Medicare, because the cards still to this day have a red, white, and blue banner on them.
Yeah.
And you get issued that card. That is the coverage that you get. Part A, which covers inpatient services and hospital services. Your Part B that covers your doctor's bills and your outpatient services. Your Part C, which is your prescription. Your Part D, which is your prescription areas there. That is the coverage that you get. Part A is paid for. Part B, you pay for as a Medicare beneficiary. When you become eligible, you sign up, you're a Medicare patient. You get that as part of your life. You then have the opportunity to opt out of traditional Medicare, fee-for-service Medicare, red, white, and blue Medicare, to select one of these many Medicare Advantage plans. Then you're into a network. You have left your traditional Medicare coverage. You now have the Humanas, the Anthems of the world, the Uniteds of the world, the Aetna Health Keepers of the world, all these different plans that you can elect in place of your Medicare coverage. So be very careful. You cannot have traditional Medicare and Humana Medicare at the same time. If you have Humana Medicare, you have given up your traditional Medicare coverage to have that Advantage plan in place of it. So I think that's very important. And there's often confusion out there, particularly with some of our senior population, that get a Humana card in the mail and then walk into a doctor's office or a hospital and present a Medicare card. Now, thankfully, we electronically verify coverage and say, no, I'm sorry, Cami, you don't have Medicare. You have Humana Medicare. And we get that fixed most of the time. But you're right. It's confusing. It's intimidating at folks, particularly those that are either new to the coverage or are older and generally have help from family members or friends that are helping them guide this. But it's very important you know that distinction between Medicare and Medicare Advantage.
So this change specifically, we've talked a little bit about how it's affecting the Advantage plan versus regular Medicare. How is it going to affect, like you mentioned, prescription? How is it going to affect like the drug plans that people have in place?
If you have traditional Medicare and then you have a Humana supplemental drug plan, there really is no impact here. But if your Humana Medicare Advantage is covering your drug plan, when you change your plan, and we're going to talk about changing your plan to a different Medicare Advantage plan that Centra is going to be in network in as of January 1st, or opting back to traditional Medicare as of January 1st. If you're on the Humana specific drug plan as part of your Medicare Advantage plan, you may not have coverage there. You need to be very careful with that there's confusion there. But if you change from Humana to a different Medicare Advantage plan, make sure you have the prescription coverage with that plan. Talk about this with broker, with calling the different plans, some of the resources that Cami's going to share with you on our webpage. Ask those questions to make sure you are certain that when that calendar turns to January 1st, 2026, that you have the coverage in place that you need.
Yes. So we are in the middle of this open enrollment period. It opened October 15th through, I think we said
December the 7th.
December the 7th. And so, as you mentioned, there are other plans that you can opt into in place of this Humana situation. What are those plans that Centra is a part of?
And let me circle back just a little bit, Cami, because I think it's important to mention, I talked about when we started having these discussions about we're not going to renew our agreement. We're going to terminate our agreement with Humana in January. We were very careful to notify Humana actually earlier than we were required to. But more importantly, get this message out to our patients and that have coverage with us or that are Centra patients and want to make sure everything is appropriate, that we timed it to be during this open enrollment period. So we're saying as of January 1st, 2026, we will no longer participate in the Humana network. You have from October 15th, which is a couple of weeks ago, up through December 7th to opt out of Humana and select one of the other plans that we have. Please go to our webpage. They're listed there.
Mm-hmm.
I'm not going to give you an exhaustive list because I'm going to forget one of them, but Anthem, Aetna Better Health is out there. United Healthcare is out there. We fully participate with those plans. You can opt to one of those, and then your coverage will be in force from 1/1/26 going forward. You can also opt back to traditional Medicare, the red, white, and blue, the unrestricted, as I would call it, Medicare coverage, and you would be covered at Centra. We are a fully Medicare participating provider.
Okay.
So those are the important things to think about, and why it was very important to open this discussion when patients have the free chance to move for the next 30 to 40 days. No pre-existing checks, no paperwork to fill out. You simply go and opt out to change plans. It is meant to, again, the government's involved, so it might be a little sticky on some of it, but generally it's a very easy process to say, I want to opt out of Humana. I want to go to plan A, B, or C, or I want to go back to traditional Medicare as of this date.
Okay.
And you have that open period to do it.
Okay.
I think there's a lot of concern out there, Cami, with, I have Humana and I see a Centra doctor. Mm-hmm. I'm going to have to change doctors. No one said that. No. That is not true. If you're with a Centra physician, through Centra Medical Group, if you're seen at a Centra location, an emergency room, an outpatient center, if you go to a plan that we participate with, you don't have to change your doctor. Your doctor that participated with Humana through Centra is going to participate with the other plans that we accept. So please don't get caught up on that, because that is not an issue.
Yes. So you need to change your plan, not your doctor.
Absolutely.
So what does it mean for some of our patients, knowing that you need to change your plan and not your doctor during this open enrollment period? Let's say they already have an appointment scheduled January 1, after January 1. How does that impact their care at that time?
The difficulty there, Cami, is that if they do not change their plan, after January 1, we will be out of network with the Humana Medicare Advantage plan. That means that, and this is separate from emergency services, and we can talk about that in a bit, that you may not be covered for the service that you seek. You may be covered at a lower rate. You might be hit with out-of-network payments where it will increase your copay or your deductible depending on your plan. Mm-hmm. So be very aware of that. You will always be covered for emergency services. Medicare requires even out-of-network to cover emergent services, the emergency room, inpatient hospital services related to an emergency situation, the doctor bills that are included with that, emergency physician bills, are all required by the law to be paid and to be covered. So that's not an issue. The issue is for non-emergent care, for routine care, for services that you need to see your primary doctor. That's where it is going to be a little bit of a path to navigate if we are not participating in Humana going forward. That's why it's important to not have Humana if you're going to continue to be seen at Centra.
Okay. So we've kind of zigzagged through the questions here and have landed at what do we need to reiterate? But before we get there, is there anything I haven't asked you specifically that you think is really important to know about this?
I think it's important, Cami, to mention this is not a decision that Centra made in a silo. Yeah. This is, as I mentioned, the patient perspective has been forefront the entire time. Yeah. And what else has been, very telling is that this is a national discussion. This, through our associations and work that we do and other, through the news media as well, that we see health systems, physician groups leaving Medicare Advantage plans in droves. I've been doing this, Cami, for 30 plus years. I've never seen it at this rate. I mean, folks are always changing. Yeah. Looking to do different rates, want to get out of a certain line of business. You see that a lot. I mean, it happens. It has not happened in this area in a long time. But nationally, I've never seen it at the pace it is right now. That we see lists of hundreds of health systems, physician groups across the country that are terminating agreements with Humana and some of these other plans, but we see a lot of Humana. So that doesn't influence us. I'm not saying that's part of the decision, but we made our decision independently. However, we were very interested to see that we are not alone in saying and drawing a line and saying, enough is enough here with the practices that they have and the financial detriments and the barrier to care for our patients that we can talk about as well.
Yeah. So I want to reiterate again, open enrollment is open now. Those of you who have gone to the website, because it's been up for, I want to say, about 2 months, there is a wealth of information, and that is at centrahealth.com/Humana. There is a frequently asked questions if you just need to know what you want, what you need to know. How are you impacted right now? So I encourage you to go and check that out. We will also put the link down in the description. That is how you can learn more. You also mentioned calling a broker. For those who are, I would assume those who are involved in this are probably familiar with that, but just in case, how would they go about finding a broker that is going to direct them in the way that's going to suit them best?
There is a numerous number of insurance brokers out there that their function is to help patients find plans that best suit them, best suit what they need, what kind of coverage they need, and to guide them to, is a Medicare Advantage plan your best choice? Mm-hmm. Is traditional Medicare a choice? And there's different costs to go back to traditional Medicare, for example, but there is less restrictions when you're on traditional Medicare. And I think, if you don't mind, Cami, let's talk about that just for a minute.
Yeah.
Part of the reason, mentioned some of the reasons that we are going away from Humana Medicare plan, is the significant amount of prior authorization they require for any patient that needs services. They are requiring for certain services over 90% of the time that a prior authorization is obtained. For a majority of those services, Medicare does not require authorization. They rely on the documentation and the health system to decide what is appropriate per Medicare guidelines. Medicare Advantage plans have us jump through a lot of hoops, have patients jump through a lot of hoops to get an MRI that you need, to get a CT scan that you need, and to delay it 3 days, 7 days, 14 days while they review documentation, deny the claim, we have to resubmit, we have to go back, and we have to ask one of our providers, a physician, a PA, to come off the line of treating patients to talk to an insurance plan of why it's important that I get a CT scan. Where with Medicare, traditional Medicare, you don't have that. The documentation is there, that's not done. That's put a tremendous barrier out there. It's an administrative burden for the health system, absolutely. And we employ people that what they do is chase Medicare Advantage plans all day to get authorization for the hundreds of folks that are coming in every day for outpatient testing and services. What it's also doing is driving a wedge for the patient, getting tests rescheduled. Your doctor saying to you, Bob, I'd like you to have an MRI, but we have to wait for Humana Medicare to authorize it. It could take 7 to 14 days. You're saying, I need to get this done. I want to get this done. You're anxious about it, and we're trying to help you get it done. But we, along with you, have to jump these hoops, go over these hurdles to get this done. Traditional Medicare, we could schedule it. If we had an opening this afternoon, we could get you in that schedule. If we had an opening tomorrow morning, we could have your test done tomorrow morning if you have traditional Medicare. If you have a Medicare Advantage plan, particularly Humana, who's very aggressive with required authorizations, we're not going to be able to do it for probably a week or more, potentially 2 or 3 weeks, based on their schedule.
And being that this is a national problem, that's not let me go somewhere else and get it done faster. That is the current situation across the board.
Absolutely. And we have not even talked about that burden to the patients, and some of the reasons that we looked to end this agreement was the difficulties that we have of getting reimbursed fairly.
Yes.
For what we're seeing. Medicare many years ago, and prior to even me being in the business, which was a long time ago, They set up, Medicare is a cost-based service. And we're going to go a little deep here, Cammie. I'm going to try to keep it
I appreciate it.
Fairly level. But Medicare is set up as cost-based. That health systems, doctors, or when they have a Medicare beneficiary, you're billing and getting paid what your costs are. We're not supposed to make any money. We're not supposed to lose any money. We're supposed to break even. You'll hear the term break even on Medicare. So it's a pretty good setup. If we at the end of every year we file reports to say, we've lost money because of expenses here, or we've made too much, and we adjust our payments to get into that break even. It actually works pretty well. It's a pretty good system. Medicare Advantage came along and said, well, we're not going to do that cost report, or we're not going to do that cost or price shifting. We're just going to pay you 102% of Medicare. Boy, when you first hear that, you're like, okay, if Medicare is break even, and we're going to get 2% more than break even, we've got a little bit of room there. We can make this work. Now, we know we've got more burdens here. We know we have to do prior authorization, and that's expensive. We have to employ folks that do that work. We have administrative burdens. We get more denial. I'll talk about that, getting more denials of care going forward. So you would think, okay, you're getting 102% of Medicare. Long story short, at the end of the day, when we reconcile prior years with Humana in particular, we found that we're getting 93% of Medicare. So we are 7% underwater with Humana with every patient that we see. So it's not sustainable. We cannot continue to have the services that we have, losing 7% on every patient that we see. It's just not sustainable. And it's systematic of how they force a long time and a lot of work to get authorizations. They deny, and I think this is one of the most surprising and headline comments, Cammie, is that they deny over 60% of our emergency claims. 60%. 6 out of every 10 claim they send back to us and say, we're not paying that bill the way it's coded. We code, again, another long story, but let me bring it to basics. We code based on a national standard agreed to from a lot of health systems, the American College of Emergency Physicians. We've got written guidelines that say, if this kind of work is done, it's a level 1. If this kind of work, it's a level 2. All hospitals use it pretty much. We submit the claim. Humana comes up with their own criteria and denies 60% of our claims.
Wow.
So we have to manually resubmit 6 out of every 10 claims. Claims go electronically, but now we have paper. We've got to send paper. We have to send copies of the medical records. We have to pay a nurse to look at it and write an appeal and why we did it. We have to pay a certified coder to look at it maybe and decide this is appropriate. We did it. They're appropriate the majority of the time. The majority of the time. We're appealing them all. But here's a hidden little pitfall. While we're appealing these, thousands of claims per month, we are not sending the patient their final bill. Patients have a copayment, a percentage, a deductible, and until we finalize the insurance benefits, we don't release the patient bill.
Wow.
This process takes months and up to a year or more sometimes when we're going back and forth trying to get paid. When Humana or others pay these claims late, and Humana has a significant volume of these, we are not billing that patient, and then we do. So you might have been seen in the emergency room in January. By the time we get Humana to pay, it's October.
Wow.
And then we're going to send you a bill in the mail because you owe a $50 copayment on the ED that we were not able to collect when you were at the hospital. And the instant reaction, and we see it, and we get a lot of phone calls on it, is Centra's delayed. They can't get their billing straight. I had this service in January.
And meanwhile, you're fighting for them.
We're fighting for them the entire silently because we don't send out bills. We don't say, hey, we're fighting Humana, or other payers. It's not just Humana, but Humana is certainly at the forefront. We're doing all this work, So we have our customer service center. They do a brilliant job out there. Please call them at 200-3777 if you have any of those questions. Because we'll walk you through that. If you're getting a late bill, we'll explain to you why you haven't seen that claim. We want your help to go back to not only Humana, to all of these payers and say, why are you taking so long to pay this claim? I'm ready to blame Centra and say Centra's billing is delayed or there's issues with Centra billing, when we're trying to get the maximum amount we can from your coverage that you have paid for, earned, and deserve, we want to get the most. We don't want to bill you for it. We want your payer to pay it.
Yeah.
So we are not going to send you that bill until that is resolved.
So you've done everything you can.
That is very disheartening for us, and our folks that work so hard, explain that, and then they read some of the background or some of the noise about that, and it's just not true.
It's tough. Yeah.
It's tough to read, and our folks take it very seriously and want to help patients. So if you see this, please don't be angry and pay it and then just don't say it. Call us. We would love to explain it to you, why it took so long, what was going on, what we were trying to get paid, what the payer did. Mm-hmm. We want to explain it to you. So please call us.
Yeah, context is everything. We'll put that number in the description as well. Because to be informed, not just about the care that is available to you and the Medicare decisions that you do have to make in this open enrollment season, but then what is happening with your specific bill, to just know that there's that number as a resource to call, I think is huge. So we will make sure you all have that as well. This has been so informative.
It's a lot, Cammie.
It's so much. It's so much. And I encourage you all, keep educating yourself on this information and advocating for yourself with this information. Start with the website, centrahealth.com/Humana. And then we'll put that number down there for you to call as well. And thank you for joining us.
Thank you, Cammie. Enjoyed it.
And thank you all for joining us on And So Much More.